Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. I'm Brittany Schaefer. Today we're speaking with Richard Kenny, who is a certified recovery coach. What is a recovery coach?
A recovery coach is what we call a person with lived experience with substance use disorder. And so what that means is someone who's kind of been there, done that. Recovery coach, according to the academy, is an ally, a motivator, a wounded healer, if you will. And what they do is support someone, and how that differs from like a counselor or even like a sponsor in one of the 12-step programs is that they're really more like joining and trying to have a mutual discovery. It's more about how can we help you in your recovery today versus kind of digging up the past is not really a part of it. You're kind of just like meeting the person where they're at and helping them today and moving forward.
What does the training to become a recovery coach entail?
I went to an academy, and it has some a matrix of different classes, including ethics and cultural competencies, and what that entails is just kind of like what you go through and kind of like how to best serve the people.
How does your interaction with recovery patients begin?
What we do is we started off with an initiative that sees inpatient people with alcohol use disorder or substance use disorder, and we get referrals from a myriad different places, social workers, doctors, and that's what makes it so cool. Get to meet a lot of people. I meet them bedside, and I'll tell a guy, I'm here to support you while you're here, but then when you leave, I'm here to support you in the community. And that's really what's lacking previously, because people, they get all this good treatment and then they leave. So our idea is that we'll see them here, coach them in the community, so they have a little follow-up, if any providers, a warm handoff, that kind of a thing.
Does your role in a person's recovery end when they leave the hospital?
So if I see them bedside, I'll immediately, because the role's different in that, like, a doctor's not going to ask you for your personal phone number. But because my criteria lives on lived experience, I'm going to treat them like a peer. So I'm just going to say, why don't we plug my number in now? Here's my UMass card. I try to call them, because a lot of times when we're dealing with these things, we're not usually the first one taking the initiative to call the guy. So I usually call them, follow-up calls, and then meet them in the community.
How do you connect with a patient to help them in their recovery? I
first off level the playing field by telling them, I get it. You're okay. You're safe. You know, it's good that you're here. And then from there, it gives them a little bit more built-up trust. Because a lot of these people, they didn't come here because they're seeking help. Right. But we can start the process now, save a lot of headaches and heartaches later. And then I just say, like, let's start today. We don't have to worry about what happened in the past. Let's look forward. And, you know, and like I said, we meet them where they're at. And then we build on a new foundation. We always try to honor the patient and savor their autonomy and what they want to do. That's kind of the basis of it too. Self-direction.
How do you use your personal experiences to help patients recover?
One of the jobs of a recovery coach is to be a resource broker. So my own experiences in treatment, heck, even on the streets out here, it's like it becomes a unique experience. Quite literally in Worcester, like, I know how it is out here. I know the shelters. I know the halfway houses. I went to one myself. So I'm able to really bring a unique perspective and really like an experiential knowledge that most probably couldn't. Every day I go to work, I have a doctor say thank you to me, because he knows that I might be able to get in there where he couldn't.
How do you help patients overcome the difficulty of breaking an addiction?
A lot of people will say things like, oh, you really got to want it. Sometimes we need to help. That's kind of where I come into. The motivation to want and raising that ambivalence is important, because when you're in it, you're not wanting anything except for that thing. So to say like, oh, he's not ready, I believe we got to help ensure readiness. Once you find a community that you can connect with and engage with, it becomes a lot easier. See, the problem is we are lonely people and we treat it with isolation, you know, and that's not good. We need to like get out there and meet people. You get used to how hard it is. So once you're going to whatever preferred thing you like, 12-step, faith-based, you really need to like sink your teeth into it. It can't be half-hearted. But also, I think when we have good providers and people that are supporting and rooting for us, it really helps that. You know, but for far too long, we haven't had things like that. Once you get to feel the fruits of the recovery process, then it's easier to change. But until then, it's just hard, and that's why people keep showing up.
How do you interact with doctors?
I'll go see their patient, and they're glad because they know, like I said, I might be able to get in where they couldn't. And so after that, I'm the type of guy, I'm a talker. So I love to just talk to the doctor, kind of give them my personal insights. Again, I'm not making medical decisions, but I am gaining some insight to the person. And then I kind of let them know that also as a recovery coach, as an advocate, that I will talk to our team doctor, the addiction psychiatrist, that this person may be eligible for some treatments that I can't prescribe or whatever. But in that way, the chain doesn't break. We're all in it together. It's, as they say, a true multidiscipline. And then when I react with that doctor, like I used to honestly be afraid because of my own past and things I've been through. But today I'm happy to report to you that I can go up to, especially one that I know better than some others, shake his hand and be like, hey, I think we're doing really good work. And it's reciprocated.